Hi, I'm Dr. Bill Lile, and today's topic is we're going to talk about patients' rights. Specifically, if a patient wasn't born in the United States, do they have the right to access to health care here in the United States? So we're going to go through a couple of examples. First, if a patient is in my office that was not born in the United States, but they desperately need a blood transfusion, do I as a physician have an obligation to find a way to get them that blood transfusion, even though they weren't born here in the United States? Second patient, if I have a patient again that was not born in the United States, but they're here in my office and they need life-saving vascular laser surgery, but they weren't born here in the United States, do I as a physician licensed here in the state of Florida, do I have an obligation to find a way to get them that life-saving treatment? Third example, if I have another patient, again not born in the United States, that desperately needs heart surgery to save their life, but they weren't born in the United States, do I, as a board-certified licensed physician, have an obligation to find out how we can get them that life-saving heart surgery? And I would say that on all three of those examples, even though they weren't born here in the United States, as a physician whose goal is to heal and to improve quality of life, I have an absolute moral and legal obligation to find access to care for these patients who are facing these problems. But what I didn't tell you is that not only are all three of these patients my patients, not only were all three of these patients not born in the United States, all three of these patients have something else that is in common, and that is that they are all still in their mother's womb. Yeah, they're my patients. When a pregnant mom comes into my office, I actually have two moms that are walking in, the mom and the baby. And you think, well, you said blood transfusion. Yeah, we have done blood transfusions directly to babies to save their lives as early as 18 weeks gestation. And you said, but you said vascular laser surgery. Yeah, there are centers around the country that when twins are sharing a placenta, but they're not sharing it equally, they can actually go in and do vascular laser surgery, essentially to say, this is your side of the placenta, this is your side of the placenta, and save their lives. And you say, well, you said heart surgery too. Yeah. As early as 22 weeks gestation, centers around the country are saving babies' lives by doing surgery on babies' hearts. I mean, 22 weeks. The heart is the size of a grape, but it's still beating about 140, 150 times a minute. Yet the centers and the cardiologists are actually doing procedures like valvuloplasty, septoplasty. They're doing surgery on the baby's heart, which will save their lives. So do we treat God's preborn as patients? Yes, we sure do. And patients have rights. Patients have rights on the outside of the womb, but patients have rights on the inside of the womb. This is a matter of patients' rights. If a patient is a person, then a patient that is in the womb is also a person and deserves our protection. God bless you all. Use this as a great argument when it comes to saving the lives of God's preborn, which are really nothing more than persons in the womb. And to me as a physician, they're my patients within the womb. God bless you. If you have any questions, you can go to my website, which is prolifedoc.org.